Autoimmune hepatitis. What is autoimmune hepatitis? Autoimmune hepatitis is a chronic disease in which your body's immune system attacks the liver and causes inflammation and liver damage. Without treatment, autoimmune hepatitis may get worse and lead to complications, such as cirrhosis and liver failure. Types of autoimmune hepatitis. Experts have identified two types of autoimmune hepatitis, type 1 and type 2. The immune system makes different autoantibodies in each type. Type 1 autoimmune hepatitis is much more common than type 2, which mainly affects children. How common is autoimmune hepatitis? Researchers aren't sure how common autoimmune hepatitis is in the United States. Studies conducted in northern European countries have found that between 10 and 24 of every 100,000 people in that region have autoimmune hepatitis. Researchers have found that the disease is more common among Alaska Natives, affecting about 43 of every 100,000 people. Who is more likely to have autoimmune hepatitis? Autoimmune hepatitis can occur at any age and affects people of all racial and ethnic groups. The disease is more common in girls and women than in boys and men. Type 1 autoimmune hepatitis occurs in people of all ages, while type 2 more often affects children. What other conditions do people with autoimmune hepatitis have? Some people who have autoimmune hepatitis may also have features of liver diseases that affect their bile ducts, the tubes that carry bile out of the liver, such as primary biliary cholangitis, PBC, primary sclerosing cholangitis, PSC, bile duct problems that can't be classified as PBC or PSC. People with autoimmune hepatitis are at risk for having other autoimmune diseases. Examples include celiac disease, thyroid conditions such as Graves' disease and Hashimoto's disease, rheumatoid arthritis, type 1 diabetes, inflammatory bowel disease, such as ulcerative colitis, vitiligo. What are the complications of autoimmune hepatitis? Autoimmune hepatitis may lead to complications, but early diagnosis and treatment can lower your chances of developing them. Acute liver failure, cirrhosis, liver failure, liver cancer. What causes autoimmune hepatitis? Experts aren't sure what causes autoimmune hepatitis. Researchers are still studying the environmental triggers that play a role in autoimmune hepatitis. These triggers may include certain viruses and medicines. Some medicines can cause liver injury that resembles autoimmune hepatitis. In most cases, the liver injury goes away when the medicine is stopped. The most common medicines that cause liver injury that resembles autoimmune hepatitis are minocycline, an antibiotic used to treat acne, and nitrofurantoin, an antibiotic used to treat urinary tract infections. Telling your doctor the names of all the medicines you take, even over-the-counter medicines or herbal or botanical products, is important. What are the symptoms of autoimmune hepatitis? People with autoimmune hepatitis may have some of the following symptoms: feeling tired, joint pain, nausea, poor appetite, pain over the liver, in the upper part of the abdomen, yellowish color of the whites of the eyes and skin, called jaundice, darkening of the color of urine, lightening of the color of stools, skin conditions, such as rash, psoriasis, vitiligo, or acne. When symptoms of autoimmune hepatitis are present, they can range from mild to severe. Some people with autoimmune hepatitis have no symptoms. In such cases, doctors may find evidence of liver problems during routine blood tests that leads to a diagnosis of autoimmune hepatitis. People without symptoms at diagnosis may develop symptoms later. Some people with autoimmune hepatitis don't have symptoms until they develop complications due to cirrhosis. These symptoms include feeling tired or weak, losing weight without trying, bloating from a buildup of fluid in the abdomen, called ascites, swelling of the lower legs, ankles, or feet, called edema, itchy skin, jaundice. Treatment for autoimmune hepatitis. Doctors treat autoimmune hepatitis with medicines that suppress, or decrease the activity of your immune system. reducing your immune system's attack on your liver. The medicines doctors most often prescribe are corticosteroids, prednisone or prednisolone, with or without another medicine called azathioprine. Doctors typically start with a relatively high dose of corticosteroids and then gradually lower the dose. Your doctor will try to find the lowest dose that works for you. Your doctor will use blood tests to find out how you are responding to the treatment. A decrease in levels of the liver enzymes alanine transaminase, ALT, and aspartate transaminase, AST, shows a response to treatment. ALT and AST falling to normal levels shows a full response. In some cases, a doctor may repeat a liver biopsy to confirm the response to treatment and find out whether the damage has resolved. Treatment can relieve symptoms and prevent or reverse liver damage in many people with autoimmune hepatitis. Early treatment of autoimmune hepatitis can lower the chances of developing cirrhosis and other complications. A minority of people who have no symptoms or only a mild form of the disease may or may not need medicines. Remission. With treatment, you may go into remission. Remission is a period when you don't have any symptoms, and your test results show that your liver is working better and is no longer being damaged. If you are in remission, your doctor may gradually lower the dose of medicines again and may stop the medicines. Your doctor will continue to perform routine blood tests for ALT and AST and monitor your symptoms while you are in remission to check for a relapse. Many people with autoimmune hepatitis go into remission. If people don't go into remission after taking the medicines discussed above, doctors may prescribe other medicines to try to achieve remission. Relapse. After a period of remission, you may relapse if your medicines are withdrawn. When you relapse, blood tests show a rise in ALT and AST, and the autoimmune hepatitis begins causing symptoms or damaging your liver again. Most people who have medicines withdrawn during remission relapse. If you relapse, your doctor will restart or adjust your medicines to treat the disease. Autoimmune hepatitis is often a long-term, if not lifelong, condition. Your doctor will need to watch your condition carefully, particularly when treatment is stopped, because the liver damage may return quickly and may be severe. Stopping treatment without your doctor's guidance and monitoring may be very dangerous. Incomplete or failed response to treatment. Some people with autoimmune hepatitis have an incomplete response to treatment, meaning that treatment helps but does not lead to remission. If you have an incomplete response to treatment, you may need to take different medicines to help prevent liver damage. Some people may fail to respond to treatment, meaning that the inflammation and liver damage of autoimmune hepatitis keep getting worse. Your doctor may recommend additional blood tests and higher doses of medicines. If liver damage leads to complications, you may need treatment for complications. Do medicines used to treat autoimmune hepatitis have side effects? Medicines for autoimmune hepatitis can cause side effects. Your doctor will monitor any side effects and help you manage them while you take these medicines. Your doctor also may adjust the doses or change the medicines you take. And you may need to stop taking corticosteroids or azathioprine if you have severe side effects. Side effects of corticosteroids may include changes in how you look, which may include weight gain, a fuller face, acne, or more facial hair. Diabetes. Eye problems, such as cataracts or glaucoma. High blood pressure. Loss of bone density, called osteopenia. Mental health problems, such as extreme changes in mood or psychosis. Pancreatitis. Side effects of azathioprine may include low white blood cell count, nausea or vomiting, skin rash, liver damage. Pancreatitis. Corticosteroids and azathioprine suppress, or decrease the activity of your immune system, which increases your risk for infections. These medicines can also increase your risk of developing cancers, especially skin cancers. How do doctors treat the complications of autoimmune hepatitis? If autoimmune hepatitis leads to cirrhosis, doctors can treat health problems and complications related to cirrhosis with medicines, surgery, and other medical procedures. If you have cirrhosis, you have a greater chance of developing liver cancer. Your doctor may order an ultrasound or other types of imaging tests to check for liver cancer. If autoimmune hepatitis causes acute liver failure or cirrhosis with liver cancer, or liver failure, you may need a liver transplant. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.